All right, so let's dive into this case. Here, we're dealing with selected images from a renal dimercaptosuccinic acid DMSA scan. Straight away, I notice a marked discrepancy in the tracer uptake between the two kidneys, with significantly increased tracer uptake on the right side compared to the left. This is very evident when we look at the differential renal function. It's 95.5% for the right kidney and only 4.5% for the left, which is quite a dramatic difference. Given the low tracer uptake on the left side, we're already thinking about conditions that could lead to such a reduction in function. It's difficult to estimate the size of the left kidney on this scan due to the global reduction in tracer uptake, but I'd be concerned about a left-sided pathology causing this dysfunction. Differential diagnosis-wise, I'm thinking about possibilities like renal artery stenosis, especially if this was an adult patient. However, in a younger patient, something like multicystic dysplastic kidney, MCDK, would jump to the top of my list. Obstruction could also be a possibility, but the next step would likely be an ultrasound to provide more clarity on the anatomical detail. Speaking of ultrasound, we also have some selected renal ultrasound images to review. When I examine the left kidney, I see that it's grossly abnormal. It's larger than expected for this age group, measuring about 6 centimeters, and I can clearly see multiple large cysts, mostly located cortically. There's minimal normal renal cortex left, which is highly suggestive of multicystic dysplastic kidney. The right kidney, on the other hand, looks fairly normal for a young child and measures around 5 centimeters in length. This makes me even more confident in the diagnosis of a left-sided multicystic dysplastic kidney. The absence of normal renal cortex and the presence of large cysts are classic features. This condition, MCDK, is a congenital anomaly where the affected kidney is filled with non-communicating cysts and lacks normal function. Now, if this was an antenatal diagnosis, the size of the cysts and kidney could have been picked up earlier. It's interesting to note that affected kidneys often regress over time, although they may remain non-functional. Let's anticipate some questions that might come up during the exam. An examiner might ask, what would you consider in the differential diagnosis here? Well, one of the key differentials would be renal agenesis, especially if we had a non-visualization of one kidney. That might lead us to think about compensatory hypertrophy of the contralateral kidney. Other conditions to think about include ectopic kidneys, cross-fused renal ectopia, or even autosomal recessive polycystic kidney disease, RPKD, though RPKD tends to present with smaller, uniformly cystic kidneys that are harder to visualize on ultrasound. Another question could be, what other anomalies are associated with MCDK? Unilateral MCDK can often be associated with contralateral urinary tract abnormalities, such as vesicoureteric reflux or obstruction, so it would be important to investigate further. Extrarenal anomalies like cardiac and gastrointestinal defects can also be seen, although not as frequently. You might also be asked, what would be the next appropriate investigation? Given the findings on the DMSA and ultrasound, I would consider further imaging like a renal Doppler ultrasound to assess the vascular supply, or a voiding cystourethrogram, VCUG, to check for vesicoureteric reflux. However, since the left kidney is already non-functional, follow-up would likely focus on monitoring the right kidney for any compensatory changes or associated abnormalities. In summary, this is a case of a 14-day-old infant with multicystic dysplastic kidney on the left side. The right kidney appears normal, but further follow-up will be essential to ensure the function of the contralateral kidney remains intact. So, that's a wrap on this case. If you found this explanation helpful, don't forget to subscribe to Radiology Made Easy. Let us know in the comments if you've encountered similar cases, and feel free to share your thoughts or questions. Keep learning, and let's make radiology easier together.